Discharge plan for major depressive disorder. Depression. Depressive disorder, also known as depression, is a common mental disorder. Globally, an estimated 5% of adults suffer from depression. More women are affected by depression than men. Depression can lead to suicide. People who have lived through abuse, severe losses, or other stressful events are more likely to develop depression. Although there are known effective treatments for mental disorders, more than 75% of people in low and middle income countries receive no treatment. Barriers to effective care include a lack of investment in mental health care, lack of trained healthcare providers, and social stigma associated with mental disorders. Symptoms of depression: experiences depressed mood, feeling sad, irritable, empty, which is different from regular mood fluctuations, and lasts most of the day, nearly every day for at least 2 weeks. Loss of pleasure or interest in activities, poor concentration, feelings of excessive guilt or low self worth, hopelessness about the future, thoughts about dying or suicide, disrupted sleep, changes in appetite or weight, feeling very tired or low in energy. Contributing factors: unknown cause, combination of biological factors like genetic, biochemical, stressful life events, hormonal inflammation, diathesis stress model, or psychological factors like cognitive theory and learned helplessness. Anatomy and physiology of brain related to depression. Neurotransmitters, they're signaling molecules in the brain. Message relayed from one neuron to the next. Regulation of neurotransmitters plays an important role in development of depression since neurotransmitters regulates brain functions like mood, attention, sleep, appetite, cognition. Another one is the monoamine deficiency theory. Underlying underlying basis of depression is low levels of serotonin, norepinephrine, or dopamine. All are called monoamines because they have one amine group. Each of these might have an impact on certain symptoms of depression. Number one is norepinephrine, which for anxiety and attention. Second is serotonin, obsessions and compulsions. The third one is dopamine, attention, motivation, and pleasure. The profile of the patient. The patient's name is Gray Meredith. Her age is 35 years old. Gender, female. Culture, Caucasian, Canadian. Community, she lives in Saskatoon, Saskatchewan, and lives in an apartment. Her diagnosis is major depressive disorder, sudden worsening. History: Meredith was referred to treatment after having a stillbirth. She showed symptoms of grief or complicated bereavement and suicidal ideation, and she has significant weight loss. Comorbidities: she has eating disorder. For social support, her family and husband is very supportive. Nursing process. Therapeutic communication skills during assessment. Number one, tell me more about how you're feeling today. Asking an open ended question invites a full descriptive response. It facilitates the expression of thoughts, feelings, and information about experiences, perceptions, or response to a situation. Number two, I'll stay here and sit with you a while. Offering self offers presence, interest, and a desire to understand. It's not offered to get the person to talk or behave in a specific way. Nursing care plan. The first one is risk for self-directed violence related to hopelessness, as evidenced by verbalization of suicidal ideation. Treatment goal. Within 24 hours, she verbalized at least one reason to live and identify a supportive person to contact during crisis. Nursing intervention. Conduct suicide risk assessment regularly. Evaluation. Client verbalizes reasons for leaving and safety measures. Treatment outcome. No suicide attempts or self-harm during hospitalization, and client demonstrates use of safety plan when distressed. The second nursing care plan, imbalanced nutrition less than body requirements related to decreased appetite and reduced food intake secondary to depression, as evidenced by significant unintentional weight loss. The treatment goal is in 4 weeks, client will consume 50 to 75% of each meal daily. Nursing intervention, assess weight, BMI, and dietary intake daily. Evaluation, client reports increased interest in eating within 1 week. Treatment outcome, gains 0.5 to 1 kilogram per week until goal weight is reached. Pharmacological intervention. Fluoxetine is an antidepressant and belongs to a group of medicines known as SSRIs, or selective serotonin reuptake inhibitors. It is recommended as the first-line therapy for most types of depression. The risk of lethal overdose is minimized with SSRIs. A relevant patient teaching for this medication is that it causes discontinuation syndrome, such as dizziness, insomnia, nervousness, irritability, nausea, and agitation, which may occur with abrupt withdrawal, depending on the half-life. The medication should be tapered slowly. It is also contraindicated in people taking MAOIs or monoamine oxidase inhibitors. Psychological treatments of depression are behavioral activation, cognitive behavioral therapy, interpersonal psychotherapy, and problem-solving therapy. The community support resources that the client can call there are three community support resources. Number one is SCIS, which is the Saskatoon Crisis Intervention Service. Second one is Saskatoon Community Clinic, and the third one is Canadian Mental Health Association, which are all located in Saskatoon, Saskatchewan. The client can also contact these two crisis intervention resources. The first one is Crisis Services Canada. For suicide crisis helpline, call or text 988 or send message online. And the second one is PACT, Police and Crisis Team. For emergency, she has to call 911, or for non-emergency, to call 306-975-8300. That concludes my presentation for depression.